everyone, I am Dr. Ravina, NHS doctor specialised in women's health, and I'd like to welcome you to this dedicated channel for women's health. Today I have a really special guest, and he's one of my dear friends. He's actually from my medical school, and we went to medical school together. He's Dr. RAGU. He's an oncology doctor. And so for those of you that don't know, oncology is a cancer doctor, and you can probably see my friends in the background. We're actually on a break, we're on a staycation in a cottage in the countryside. It's really beautiful. And so we've just gone for a country walk, and we thought, you know what, why not use this opportunity to give a little bit more women's health information specifically for cancer. So welcome to the channel.
Glad to be here, Ravina.
Thank you, Dr. RAGU. And RAGU has so much experience in not just all cancers, but specifically in gynae cancers. So today we'll be talking about breast cancer. And RAGU is going to just talk us through what to look for if you find a lump, some of the symptoms you might have, what happens if you have symptoms, and the next course of action in terms of investigations, and also some treatments that you have. So let's dive straight in. So what is our first question? Okay, so question number 1. What signs and symptoms should we be looking out for in breast cancer?
So that's a really important question, Ravina. The commonest sign and symptoms with breast cancer is a lump in the breast.
Right.
But other symptoms include thickening of the breast tissue. You can also notice, which people don't know as much, is changes in the skin. So puckering, dimpling of the skin, or even redness in the skin which doesn't go away. Other signs of breast cancer include nipple discharge.
Okay.
So especially if you're not pregnant or breastfeeding. So that's a symptom to report to your doctor. And another symptom to be aware of is change in the nipple position. So we call nipple inversion. Okay. And any of those symptoms are symptoms you should see your doctor about straight away.
Okay, so nipple inversion is basically the nipple going inwards.
Or even a positional change in the nipple.
So if it's a bit higher, if it's a bit lower.
More the inversion, but
inversion, yeah.
But the other important one really is the lump in the breast.
Lump in the breast, okay.
And even just underneath in the armpit region as well is something to watch out for.
In the armpit, okay. So you might have seen some campaigns about checking your breasts. So that's obviously a key way to check for lumps in the breast, as that's one of the key symptoms. So what we can do is can link just a breast examination down below, so you can just check on what the technique is to do a breast exam.
Yeah, exactly.
Question number 2. So say you found a lump in your breast and then you go to see your GP. A lot of women have a lot of anxiety about what actually happens next. They worry about, okay, so what? I've got a lump, and then you may be referred, which is usually the likely thing. And in the NHS in the UK, you get referred under a 2-week wait, and then you're left wondering, okay, right, so I have to wait 2 weeks. What am I expected to do in that time? And when I do go to my appointment, what are they going to do? And there's lots of information on Google and on the internet. But RAGU, tell us what actually happens when you wait 2 weeks and you get to that appointment.
Yeah. So firstly, when you first go to see your GP, do ask them about the process which happens locally. So there's always different processes in the local area. But usually what happens is when you go see your general practitioner with a lump, they will do an examination and refer you to a breast specialist. So there are breast clinics run by doctors who specialise in breast cancer and other breast problems. The next step is you'll be seen by them. They'll do an examination. Yeah. They will likely take a sample of this lump, which is usually what's called a biopsy. They may put some local anaesthetic and numbing agent, and then take a small sample of tissue, which a doctor then looks under the microscope to see if these cells look like breast tissue or normal breast cells, or are these cells abnormal, which are concerning of breast cancer. Right. There are other causes of a breast lumps. So there are other benign, we call benign, so non-cancerous conditions which are not serious, which can cause a breast lump, but it's still very important to have that examined and checked out. And really the best way to tell if this lump is either cancer or not is by taking that sample. The other also important test to tell if it's not cancerous is an imaging modality, which could be either a mammogram or an ultrasound. So we call it a triple assessment. It is, you will have an examination by a specialist, imaging, and you may have a biopsy. Once that's happened, the biopsy takes at least usually a week to come back for the results, and then the breast surgeon will go through the results with you. And hopefully hopefully the lump is not cancerous, in which case he can talk to you about the treatment options, for that. But if it is, a cancerous lesion, then there's the next step would be where everything will be discussed in a meeting of breast surgeon, pathologists, who are the doctors who specialise in looking at the cells, radiologists, who are doctors who specialise in ultrasound and imaging, then also oncologists, which I specialise in, who specialise in giving anti-cancer treatment. And all these doctors put their expertise together to come up with the best plan for you.
Right. Yeah. So it's a very tailored sort of technique in terms of the treatment.
Yes, exactly. So if as I said, you have these three tests: examination, imaging, and plus or minus a biopsy. And then if it's not cancerous, excellent. The surgeon will talk to you about that. If it is cancerous, then you go on to they discuss your test results in a meeting, and they will tailor a treatment plan based on all of those factors. No, that's really interesting. You can tell how clever RAGU is, because he can literally just tell you all you need to know about the investigations just from the top of his head. No notes, no nothing. Okay, so question number 3. So we've spoken about the signs and symptoms, spoken about the investigations. Now, if you've got a diagnosis of breast cancer, it can be so mentally and emotionally draining. And what you actually want to know is what can be done about it. What treatment can we give for this, and what are the chances of survival? And you have so many questions about what this means for your life. So the next question is, what treatments are available for breast cancer? So firstly, I'd like to say that treatment these days are very individualized and personalized. So the treatments I will talk about are general treatments for breast cancer. However, the treatment, if unfortunately you or someone you know does have breast cancer, the treatment they will be offered, as I said, will be made from a decision of a number of doctors, and it will again be personalized to you. So generally the treatment again depends on the stage of the cancer. Stage 1 being cancer, the breast cancer is just located in the breast, and going up to stage 4, which is unfortunately where the breast cancer cells have moved outside the breast tissue, and these cells are in other parts of the body. So for stage 1 or early stage breast cancer, the treatment is generally a combination of surgery to remove the lump, and most patients will have some form of radiotherapy treatment. Again, this will be given after surgery to really reduce the risk of cancer coming back. Depending on the type of cancer risk, some patients will be put on hormonal treatment because some of the cancers are sensitive to estrogen. And then again, it's all very personalized and individualized, but we often calculate the risk of this. Coming back, and in some patients who are deemed to have higher risk of coming back, we can give chemotherapy to reduce that. So really, the main treatment is surgery. Radiotherapy plays an important part, and there is a role for hormonal treatment and potentially chemotherapy, but that really depends on the type of cancer you have and the risk of the cancer coming back. Now, if it was a type of cancer in the unfortunate situation where the breast cancer had spread to other parts of the body, then the treatments would be chemotherapy. But there are new targeted treatments available, which are again focused on what type of cancer you are, for example, and those targeted treatments may be available for you, but it really depends on what type of cancer you have.
So there are a few different options.
There are a lot. The thing with breast cancer, there are a lot of treatment options available, and that's testimony to a lot of the research going on in the field. And there's always new treatments being developed for patients. But for the early cancer where there's a lump, the main important treatment is surgery, then radiotherapy potentially, then other treatments depending on individual circumstances.
I see. So what I find is when I see women and I've assessed their breasts and they've noticed that they've got a lump, and I've assessed and I can feel a lump, a lot of women aren't actually worried about the lump, and they're actually worried about if it is cancer, what are the side effects of treatment. And one of the most common things is losing your hair. And a lot of women, of course, very naturally are worried about the implications of losing hair. And I actually remember one patient who said to me, actually, I don't actually want to know if I have cancer. I'd rather just live my life and not know. Yeah. Because the lump wasn't affecting her. She just found it. She didn't have any symptoms. It wasn't really worrying her. And she thought, actually, if I find out, then I'd need treatment. And then I might have to deal with things like hair loss. And she just didn't want to even accept like going down that route. And I can appreciate it's quite a hard thing for women to even take in, to absorb the fact that they might have cancer. So obviously you have radiotherapy, you have chemotherapy. What are some of the sort of complications of getting it? You know, hair loss is obviously one of them. Can you tell us like which one's more likely you are going to get hair loss in, and are there any other complications?
So firstly, as I said, you know, the main treatment, if it's a lump just in the breast, the most important treatment is surgery, and that does not cause hair loss. And the side effects are, you know, it's generally a very good operation. The side effects are generally very minimal, but you know, you can talk about the risks and side effects with the breast surgeons who do the operations, who are experts in this. In terms of chemotherapy, not everyone needs chemotherapy. A lot of people actually don't need chemotherapy. It really depends on, you know, what type of cancer it is. Has it spread to any lymph nodes, which may decide if we give chemotherapy or not. And that's all, again, a decision made by the oncologist, where they take in all these factors together. So firstly, if you're unfortunate to, you know, were diagnosed with breast cancer, you may not necessarily need chemotherapy. And that's a decision you have, you'll be having a discussion with the oncologist. So that's one important thing to notice. Radiotherapy, which is a common treatment for breast cancer, doesn't cause any hair loss. It really is focused in the breast, or if we do treat the lymph nodes, it's focused around the lymph node regions. And the main common side effects really, while temporary, would be tiredness, and it can cause some skin redness and reaction. But again, talk to your oncologist, and those symptoms generally improve, but do talk to your oncologist and they can go through that with you. But in terms of hair loss, radiotherapy wouldn't cause that.
And then of course, in terms of the aesthetic side of things, there's the hair loss, but of course if you have surgery, then you have to remove part of your breast tissue. So for women that have that option of just having surgery, perhaps they don't need chemo, they may still be worried about, actually, I'm going to have breasts that perhaps don't look the same, they're going to look different, the body shape will change. What options are available for women after having surgery in terms of restoring that sort of aesthetic look? So that's an important question, and do talk to the breast surgeon about that, because there are a lot of treatment options available. They can do reconstructive operations. They can, do something called symmetrization, where they can try and arrange, making sure that there's a bit more symmetry to both breasts. But there are treatment options available. Again, it depends on your individual breast size and shape, and that will be something your breast surgeon will know a lot about. So it's in essence a breast reconstructive surgery.
So they can talk through the options available for you.
So moving on to our final question. Many women are worried. They want scans. They are wondering if there can be any screening done for potential breast lumps, for potential breast cancer. So we both work in the UK. So in terms of screening programs available in the UK, can you tell us a little bit about what is available?
So breast cancer is the most common risk factor is getting older. So it really does affect people as they get older. So the screening program is really started at the age of 50, and that's every 3 years to the age of 70. And so people with the age of 50 will be invited to go for mammograms. It's not done at a young age because mammograms isn't that as good in younger women to picking up breast cancer. But if you have any symptoms, you can, and signs or symptoms you're worried about, see your GP straight away, who will refer you if they are concerned of any breast lumps. Important thing for younger women is that do regular self-examinations. It is uncommon to have breast cancer in a young age, but if you do have a strong family history, then or other risk factors, do speak to your GP, and they can refer. They can talk about, do individual risk assessments about whether you need earlier screening or not.
So really important to check your breasts, and really important to go to your screening when you get invited. And also if you're high risk, it's really important to tell your doctor about it.
Yeah,
so that's really important key information that you've given us. Thank you so much, Dr. RAGU.
Yeah,
We're so grateful that we've got a friend who's actually a cancer doctor who can give us all this information. So if you do have any further questions that you want answering by Dr. RAGU, put them in the comments below. He'll jump on board and he'll answer any questions. And if you have any specific questions, feel free to message me on Instagram at dr.ravina. And we also have a free women's health ebook that you can download from the comments below. Okay, so until next time, take care, bye.